Back in 2011, I was volunteering as part of an HIV awareness program across schools in rural India. One of the teachers I met at the school narrated the story of his 6-year-old daughter, Sheena. Earlier that year, Sheena had developed a mild case of food poisoning after a midday meal at the school. As the condition deteriorated through the course of the day, the family decided to take her to the local doctor. The doctor on duty, absent. The next morning, they went back to the doctor on duty, still absent. Frustrated, they decided to take her to the nearest primary healthcare center, 70 miles outside the village. On arriving at the center, the nurses advised moving her to the city hospital immediately, as her condition had gone from bad to worse. The city hospital was 120 miles away. They traveled for 12 hours, and they finally reached the hospital, and it looked something like this. They waited in that queue for 8 hours before they finally got to see the doctor. Unfortunately, it was too late. Sheena had lost her life. That is not even the saddest part of the story, though. All she needed that day was a doctor to give an oral rehydration solution. In fact, a timely glass of lemonade would have done the trick. Sheena is not alone. There were 700 million people straggling across the length and breadth of the country in rural India, hoping for a better medical future. And at the heart of it, the problem is really simple. There just aren't enough doctors for all of us. At 0.6 doctors for 1,000 patients, India's physician density is about 5 times lower than some of the Western counterparts. But this is not an India-centric problem. Notice the graph here. Notice the countries in the dark gray. All of these are countries with less than 1 doctor for 1,000 patients. A shocking 47% of WHO's member states do not meet this basic standard. That's over half the world's population. Now, it may come as no surprise to you that most of this population does not have access to healthcare, does not have access to doctors, does not even have access to clean water in most cases. It might, however, surprise you that the majority of this population today owns and actively uses the very same device that all of you are carrying in your pockets. I'm talking about the mobile phone. Take India, for example. Over 900 million subscribers at the end of last month. That translates into a telecom penetration north of 70%. Bear in mind that mobile phones continue to be a household purchase, not an individual one. The true access potential of this device is way more than that number suggests. Numbers in sub-Saharan Africa, by the way, are no different. So there's no doubt that mobile phones are going to be central to any change in the healthcare industry. That's a given. The question is how. There's a lot of noise from all corners of the world about digital health. iPhone apps for health monitoring purposes, device contraptions, online surgeries, you name it. The list is endless. The innovation, quite frankly, is startling. Now, there's no doubt that mobile phones and this entire technology is going to help solve some of the challenges of the developed world. But it is important to understand the challenges of the developing world are inherently different from the challenges of the West. So what then is this groundbreaking innovation that we need? Perhaps, sometimes, the true magic of innovation lies in the lack of it. With this idea of simplicity in mind, I set forth with my father, a medical professional practicing in India for over 30 years, to come up with a new age model of telemedicine. The idea is really simple. The provision of medical care using the mobile device to urban and rural customers. Now, I'm not talking about fancy iPhones here. I'm talking about the most basic of phones. And let's look at this idea a little more in practice to actually see how this would work. Let's look at the example of 3 different patients. Patient 1 decides to call the doctor. The doctor diagnoses the problem using standardized diagnosis charts. determines the course of action that the patient should take, and suggests either a basic over-the-counter drug or that glass of lemonade. In some cases, of course, the patient requires a prescription drug. The doctor electronically sends a text message to the patient's handheld device, which is then used at the local pharmacist. But sometimes doctors are simply not equipped to handle these problems. That is when we lean upon a pre-enrolled network of specialists. A doctor-to-doctor interaction takes a matter of minutes, a process that would otherwise take weeks between traveling to the specialist location and actually securing that appointment. Now, what have we done? We've taken one of India's biggest challenges in that there is a huge imbalance between the urban and rural populations of doctors and turned it into our biggest strength. Instead of simply providing electronic triads through not-so-qualified nurses, we're in a position to fill these call centers with fully qualified doctors, resulting in significantly better patient outcomes. Now, of course, we haven't come up with all of this ourselves. Leading consulting firms have come forward to give us pro bono advice on how to make this economically viable. India's #1 law firm has stepped forward to give us the regulatory green light. IT companies have come forward to help us develop the software systems required to make this a success. And the length and breadth of the medical fraternity in India has come forward at the exact point in time where we needed their support. Now, you may wonder, does this actually work? Don't take my word for it. Let's look at 3 examples from 3 different parts of the world. Mexico City, home to arguably one of the most successful telemedicine projects in the world. 4.5 million registered users, over 1 million calls each year. But more importantly, in 62% of these calls, there was no physical touch point required between the doctor and the patient. Malawi in Southeast Africa, a country grappling with a major healthcare challenge. 1.9 doctors for 100,000 patients. One of the highest infant and maternal mortality rates in the world, sorry. The country was losing an entire generation of Malawians when the government stepped forward to set up a call center exclusively dedicated for the needs of pregnant women. Yet again, in 75% of these cases, no touch point required between the doctor and the patient. I was still a skeptic. 6 months into this project, and thousands of calls later, I can safely tell you this number hasn't changed in India either. Now, on one side, this number might tell you that so many patients can actually just be treated in the phone. But think about the cost implications for a second. If all these patients can be treated at the primary care unit, we've effectively taken and stripped away the biggest cost component of the healthcare industry: secondary care and emergency room visits. Now, the second question arises, are these people savvy enough to adopt a technology like this? I was in Africa earlier this month, and the unprecedented success of mobile commerce, be it mobile banking in Kenya or mobile farming in other parts of sub-Saharan Africa, is testament to the fact that these people are, in fact, willing to adopt this. All they need is a fair chance. In fact, the concept of telemedicine is strategically placed at the cusp of innovation. Successful delivery could fundamentally revolutionize healthcare in the developing world and lead to so much more innovation. Think electronic medical records. Billions of dollars of aid which are currently pumped into these markets by international aid organizations could be, for the first time, used to eradicate disease and not just firefight it. A transformation nothing short of magical. In fact, this could be a classic case of reverse innovation as well. The model finds its feet in the developing world, paves its way into the developed world, where all of us, myself included, have these loosely based perceptions about the challenges of telemedicine. I cannot stress enough the degree to which these challenges and these perceptions hinder the adoption even on the other side of the world. But the challenges are different. And the solutions in those parts of the world must also be different. But when you think of these solutions, Think of these people. These are real people. People like you and me. People with no less of a right to health care than any of us more privileged ones in this room today. But access to health care and giving your child a basic shot at life is not a privilege. It is but one of the most basic human rights. And if you think it is a privilege, in privilege too lies a massive opportunity. An opportunity to make a meaningful difference to the lives of others. It might be hard to believe, but the magic wand with which we can create this transformation, affect these millions of lives positively, is right here with us. All we need to do is believe in the power of simple solutions. And if you have trouble, just remember, all she needed, ladies and gentlemen, was a glass of lemonade. Thank you very much.